Good evening. According to the American Veterinary Medical Association, almost 50 million households in the United States own a dog, and one of the leading causes of death for dogs involve the heart. My name is Dylan Boyer, and I'm a certified veterinary assistant, and I'm certified in canine CPR and first aid. And today, I'll be teaching you the basics of canine CPR by demonstrating proper preparation for CPR and then the steps to complete a successful resuscitation. The end goal is to successfully resuscitate an ailing dog. There are no prerequisites for this, but I recommend that if you are actually doing this on a dog, going in with a calm yet determined mindset. Okay, beginning and preparing for CPR. If you find a dog that you notice there's something wrong with, the first thing you're going to do is check its vital signs. You want to check for breathing and you want to check for a pulse. You can listen for breathing by placing your ear by the snout and just listening for a breath. You can listen for a heartbeat by placing your ear directly to the chest and listening for a heartbeat. You can also check for a heartbeat by placing your hands on the chest and feeling if you can feel a heartbeat, or placing your fingers inside their thighs to feel for a pulse. If there is no breathing, you can attempt to clear the mouth and airways of any debris. If there is no heartbeat, next you're going to properly place the dog in position. According to Marcel Schenker, a writer for Canine Journal, a journal that started in 2007 and was featured by well-known outlets such as the Washington Post, you want to place the dog on its side, it doesn't matter which side, and straighten the head and neck, pull the tongue out, and position yourself behind them. If there is a heartbeat but no breathing, there is no need to give compressions, and you can skip to the section of this video that talks about giving rescue breaths. Remember, if you realize there is something wrong with your animal and it is not breathing and it does not have a heartbeat, you want to also prepare to move the dog to the most local veterinary hospital for further treatment. Okay, next, actual steps of canine CPR. The first thing is compressions. According to the Journal of Veterinary Emergency and Critical Care, your hand should be placed over the widest portion of their chest. Place your hands on top of each other and keep your elbows straight. If you bend your elbows while giving compressions, you're going to tire yourself out faster and you won't be able to give compressions as well and as long. When giving compressions, use the palm of your hand and not your fingertips to not place any extra strain on yourself. When giving compressions, go a third of the way to a halfway down into the animal's chest. Remember, going too far can cause injury to the animal, but not going far enough won't compress the heart enough to create blood flow. Compression should be at a rate of around 100 to 120 beats per minute. According to Jog FM, a good song to pump to this would be Don't Stop Believing. So, you would give pumps like this. Hands together, arms straight, a third of the way to a halfway down to the chest. Don't stop believing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. The next step of CPR is rescue breaths. You should give rescue breaths after every 30 compressions. To give a breath, place a hand or both hands around the snout of the dog to completely close the mouth, and place your own mouth over the dog's nostrils and give breaths into the nostrils. You want to give 2 breaths for every 30 compressions. Once you have given your 2 rescue breaths, you want to go back to compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You want to complete this cycle of compressions and 2 rescue breaths until either the dog has been resuscitated, you are physically unable to continue, or you have resuscitated the dog for around 20 minutes. And so now I've shown you how to prepare for and then properly execute CPR on a dog. Remember, first, check the dog for vital signs. Next, position the animal properly for CPR. Then, give chest compressions at around 100 to 120 beats per minute. After 30 compressions, give 2 breaths, switching from 30 compressions to 2 breaths, on and off, until you are done. Remember that this demonstration and technique should only be used on a dog that genuinely needs CPR, and any dog that genuinely needs CPR should probably also have veterinary care. So, if you notice a dog that needs CPR, you need to prepare to take that dog to a veterinary hospital as well for further care. Thank you.